When we think of major cities in Canada, images of prosperity and breathtaking natural landscapes often come to mind. However, beneath these picturesque scenes lies a harsh reality, an ever-growing crisis of homelessness that many people are facing. It's estimated that between 150,000 and 300,000 individuals experience homelessness in Canada every year. In Canada, homelessness refers to individuals, families, or even entire communities who lack a safe, stable, and livable place to call home. It also includes those who have no immediate access to secure housing opportunities. However, this definition doesn't fully capture the complex and deeply personal experiences of homelessness, which often go beyond simply lacking a place to live. The impact of homelessness weighs heavily on Canada's economy, with an estimated annual cost of 7.05 billion Canadian dollars. This figure includes expenses for emergency shelters, community support services, and the ripple effects seen in healthcare, the criminal justice system, and other emergency response services. Here are the 10 cities in Canada with the highest homeless populations.
30% increase is far more than our economy can sustain, and now we know that homelessness is costing us billions of dollars.
It made perfect sense now why my lungs were so bad, why my sinuses were so bad.
Very cold start to 2022, but some people who would have been struggling to stay warm on the streets tonight now have a place to get out of the cold.
Halifax, Nova Scotia. Let's begin with Halifax, Nova Scotia, a city grappling with a homelessness crisis that affected 586 people in 2022. The primary drivers behind this issue include a severe lack of affordable housing, fueled by rapid population growth, limited available land, and the rising costs of construction. Halifax also faces significant challenges in addressing mental health issues, particularly among veterans. Many of those experiencing homelessness in this city struggle with alcohol and drug addiction, which remains one of the leading factors perpetuating the crisis. Making matters worse is the shortage of shelter beds, with only 181 available across the entire city, far from sufficient to meet the growing demand. 9. Hamilton, Ontario. Next on the list is Hamilton, Ontario, a city experiencing one of the fastest growing homelessness crises in Canada. As of January 2024, over 1,600 people were recorded as homeless. The rapid rise in rental prices, coupled with inadequate mental health services, has been the primary driving force behind this surge. Many renters in Hamilton are forced to pay significantly higher amounts than what is considered affordable, leaving them in precarious financial situations. The issue is further compounded by high rates of addiction and mental illness within the homeless community. Tragically, overdoses have become the leading cause of death among Hamilton's homeless population, followed by homicides, strokes, and heart attacks. Organizations like Good Shepherd provide emergency shelters, offering a vital safety net for those in need. However, the demand for affordable housing and comprehensive mental health support continues to far outpace what is currently available, underscoring the urgent need for long-term solutions. 8. Victoria, British Columbia. Victoria, the capital of British Columbia, is grappling with a significant homelessness crisis, with 1,665 individuals affected in 2023. One of the key factors contributing to this issue is the city's relatively mild climate, which draws homeless individuals from other regions seeking refuge from harsher weather conditions. Additionally, the city's heavy reliance on tourism has created economic pressures that disproportionately impact low-income residents, making it harder for them to afford stable housing. Chronic homelessness accounts for a staggering 67.4% of the affected population, with many individuals relying on temporary housing or emergency shelters to get by. In response to this pressing issue, the City of Victoria has partnered with organizations like BC Housing, Island Health, and other collaborators through the Regional Housing First program. This initiative has committed 90 million Canadian dollars to the construction of 2,000 new rental housing units. Victoria's housing strategy also focuses on proactive policies, including tenant protections and the development of affordable housing projects. These efforts aim to address the homelessness crisis in a sustainable and impactful way, ensuring that both immediate needs and long-term solutions are prioritized. 7. Ottawa, Ontario, where the number of homeless individuals reached 2,952 in October 2024, a notable increase from 2,612 in 2021. The primary drivers of this surge include the ongoing housing affordability crisis and a significant wage gap. The minimum wage in Ottawa is set at 17.20 Canadian dollars per hour, while the living wage required to meet basic needs is closer to 22.80 Canadian dollars per hour, creating an unsustainable divide for many low-income workers. A unique factor intensifying the situation is the large number of refugees, asylum seekers, and military veterans struggling to integrate into civilian life. Many veterans, in particular, face mental health challenges such as PTSD, which can make it even harder for them to maintain stable housing. In response to this growing issue, Ottawa has partnered with organizations like the Ottawa Mission and has adopted a federal housing strategy. However, despite these efforts, the target for affordable housing construction remains far from being met, and the need for solutions continues to outpace progress. 6. Winnipeg, Manitoba. In 2022, Winnipeg reported 1,256 individuals experiencing homelessness, with 422 residing in emergency shelters and 237 in transitional housing. The primary cause of this crisis is a shortage of affordable housing, further exacerbated by widespread mental health challenges and addiction issues among the homeless population. What sets Winnipeg apart is the prevalence of homeless encampments scattered throughout the city. These encampments create significant social and economic pressures, including an increased demand for public health services and heightened concerns around public safety. In response, the municipal and provincial governments have announced an ambitious plan for 2025. This initiative includes clearing encampments and providing housing options integrated with mental health and addiction support services. The plan emphasizes a collaborative approach involving partnerships between local and federal governments, Indigenous communities, and nonprofit organizations, all working together to create sustainable solutions for Winnipeg's homelessness crisis. Five, Edmonton, Alberta. As of September 2024, Edmonton reported 4,697 homeless individuals, the highest number since 2019. The crisis is driven by a combination of factors, including widespread addiction, poverty, and a severe shortage of affordable housing. Many people experiencing homelessness in Edmonton resort to living in remote encampments to avoid being displaced, even though this exposes them to the risks of extreme weather conditions, particularly during harsh winters. To address these challenges, programs like Community Bridge play a critical role in preventing evictions by offering financial support and crisis intervention. Additionally, the city utilizes point-in-time count data to better understand the needs of the homeless population and to allocate resources more effectively. Edmonton is also recognized for its proactive approach through initiatives like the Edmonton Homeless Commission, which prioritizes long-term solutions. Four, Calgary, Alberta. In 2022, Calgary reported 2,782 individuals experiencing homelessness. This number includes 41% living in emergency shelters, 31% in transitional housing, and others without any form of stable shelter. The primary drivers of this crisis are a lack of affordable housing and widespread poverty, with over 115,000 residents in the city at risk of becoming homeless due to financial instability. What makes Calgary's homelessness crisis unique is the transient nature of many individuals affected. A significant portion of the homeless population moves between temporary living situations, including hospitals and prisons, making them difficult to track without real-time monitoring systems. This mobility creates additional strain on public services, including healthcare and law enforcement, as they work to meet the needs of this vulnerable population. The city continues to face challenges in addressing these issues, highlighting the need for comprehensive data collection and long-term strategies to provide affordable housing and reduce poverty's grip on at-risk communities. Three, Montreal, Quebec. Montreal has long been the epicenter of homelessness in Quebec, accounting for 47% of the province's 10,000 homeless individuals in 2022, around 4,000 people. This marks a 33% increase since 2018, while the South Shore region experienced the largest spike, surging by 98%. The primary causes of this rise include skyrocketing housing costs and a severe shortage of affordable living options. In response, the Quebec government has taken significant steps to address the crisis. Efforts include expanding emergency shelters, increasing housing subsidies, and launching mental health programs designed to provide critical support for vulnerable communities. Additionally, innovative projects have been introduced to tackle hidden homelessness, a widespread but often overlooked issue where individuals temporarily stay with friends or family, lacking stable housing of their own. Two, Vancouver, British Columbia. At the second top of the list is Vancouver, a city battling a homelessness crisis with 4,094 individuals living without stable housing as of the latest count. Over the past decade, homelessness in Vancouver has grown by an average of 7.7% per year, reflecting the severity of the situation. The primary factors driving this crisis include skyrocketing rental costs, which have nearly doubled since 2012, forcing renters to spend as much as 60% of their income on housing. Additionally, the deadly impact of toxic drug use has exacerbated the problem, contributing to instability and loss of life within the homeless population. A particularly unique challenge lies in the downtown East Side neighborhood, where approximately 6,000 single-room occupancy housing units, once affordable to low-income residents, have been largely gentrified. This shift has made many of these units unaffordable, displacing vulnerable populations and further deepening the homelessness crisis. The ripple effects of this issue are felt citywide, placing immense strain on social and economic stability. Vancouver has seen increased demands for healthcare services and rising pressure on municipal resources to address the needs of its homeless population, highlighting the urgent need for comprehensive and sustainable solutions. One, Toronto, Ontario. Leading the list is Toronto, a city facing one of the most severe homelessness crises in Canada, with 10,418 individuals experiencing homelessness in 2023, a sharp rise from 7,347 in 2021. The primary cause is a dire lack of affordable housing, with over 89,800 people stuck on the waiting list for subsidized housing. The COVID-19 pandemic further worsened the situation, reshaping the demographics of homelessness to include a larger proportion of men, ranging from teenagers to the elderly. What makes Toronto's crisis unique is the high prevalence of mental health issues and disabilities among the homeless population. Approximately 75% of Toronto's homeless individuals struggle with mental health disorders, and 45% live with both mental and physical disabilities. Despite the grim statistics, there is hope. 94% of the homeless population in Toronto express a strong desire for permanent housing, emphasizing their readiness for change. In response, Toronto has taken a research-driven approach, expanding shelter capacity and enhancing mental and physical health support through organizations like Fred Victor. These efforts are part of a broader strategy to develop affordable and sustainable housing solutions for the city's most vulnerable populations, aiming to turn the tide on this growing crisis. Success stories and adaptation efforts. The city of Medicine Hat, Alberta, stands as a shining example of how homelessness can be effectively addressed in Canada through the Housing First approach. This strategy is rooted in the belief that every individual deserves access to permanent housing before tackling other challenges, such as addiction or mental health issues. Since its implementation, Medicine Hat achieved a groundbreaking milestone, reducing chronic homelessness to 0 in 2015. This success was made possible by a well-integrated system of social services that included psychological support, job training, and rehabilitation programs. Beneficiaries were provided access to affordable apartments, and the local government ensured they received ongoing guidance to help them rebuild more stable lives. Medicine Hat's achievements have inspired other cities, such as Edmonton and Calgary, to adopt similar elements of the Housing First model. While these larger cities face greater challenges due to their higher populations, the adaptation of this approach has already yielded promising results in reducing homelessness numbers. This success highlights the importance of collaboration between governments, nonprofit organizations, and local communities. By working together, they can create sustainable, long-term solutions that go beyond temporary fixes and address the root causes of homelessness. Medicine Hat's story underscores the potential of a compassionate, housing-focused strategy to transform lives and communities alike.